Interpersonal therapy, IPT, is a short-term, goal-oriented therapy that focuses on improving interpersonal relationships and addressing emotional issues. Here are the key steps to understand interpersonal therapy in a simplified manner. Assessment. The therapy begins with an assessment of the individual's current interpersonal relationships and the specific issues they are facing. The therapist explores the client's social and emotional history. Identification of problem areas. Together with the therapist, the client identifies specific problem areas in their relationships or social interactions that contribute to emotional distress. These problem areas are often categorized into one of four interpersonal problem areas: grief, role transitions, role disputes, and interpersonal deficits. Setting treatment goals. Based on the identified problem areas, the therapist and client collaboratively set specific and realistic treatment goals. These goals are focused on improving communication, resolving conflicts, and enhancing the overall quality of interpersonal relationships. Introduction to interpersonal concepts. The therapist introduces interpersonal concepts and skills to help the client navigate and address the identified problems. This may include communication strategies, assertiveness training, and conflict resolution skills. Grief work. If grief is a significant aspect of the client's concerns, the therapist facilitates a process of grief work. This involves exploring and processing feelings associated with loss, helping the client adapt to the changes, and finding ways to continue with life. Role transitions. For individuals experiencing major life changes or transitions, such as divorce or retirement, the therapist assists in adjusting to these new roles. This may involve exploring emotions related to the transition and developing coping strategies. Role disputes. When conflicts arise in relationships, the therapist helps the client address and resolve these disputes. This may involve improving communication, setting boundaries, and finding compromises that are acceptable to all parties involved. Interpersonal deficits. Some individuals may struggle with interpersonal deficits, such as difficulty forming and maintaining relationships. The therapist works with the client to enhance social skills, improve self-esteem, and foster more meaningful connections. Improving communication skills. Communication is a key focus in IPT. The therapist helps the client develop effective communication skills, express emotions appropriately, and better understand the impact of communication on relationships. Exploration of feelings. Throughout the therapy process, the therapist encourages the client to explore and express their feelings in a supportive and non-judgmental environment. Understanding and processing emotions is integral to improving interpersonal functioning. Review and closure. As the therapy progresses, the therapist and client periodically review the goals, assess progress, and make adjustments as needed. The therapy concludes with a focus on the client's ability to apply the learned skills and strategies in real-life situations. Relapse prevention. The therapist and client work together to develop strategies for preventing relapse and maintaining positive changes in interpersonal relationships. This may involve ongoing self-monitoring and the application of learned skills in various life situations. Interpersonal therapy is typically a structured and time-limited approach, often spanning 12 to 16 sessions. By addressing interpersonal issues and improving relationship skills, IPT aims to alleviate emotional distress and enhance overall well-being.